So thinking about you personally, Leanne, what do you think you've learnt about your digital skills in the last 12 months?
Oh, they were a bit rusty. I think would be the biggest learning. I don't know, I guess probably like a lot of people, I probably tried to avoid them for quite some time. Very simply using email or maybe some spreadsheets, for example, and thinking that's probably about all I needed to use. But actually seeing others putting systems in place and even being able to share something on Teams is quite amazing. So being able to do a presentation on Teams and not feeling stupid when you get it wrong has been a big learning. But the big bit for me, I think, and it's probably broader than just the digital platforms, is much more around how information can be used. And the systems like Vitals, for example, giving us information and data that says actually in Ward X, their performance with observations every half an hour when patients are deteriorating is fantastic, but it's not the same here. So being able to say, okay, what's working well here and what isn't working quite so well here. So I think the biggest bit for me is how do we use data and the information that comes out of those systems to improve our practice, which I guess really got me around to thinking about all my different parts of my portfolio and employing somebody who can help build those sets, data sets, reports, etc., that allow us to focus our attention on the areas that matter, and rather than trying to take all this breadth and depth of data and information and trying to make sense of it. So I think my biggest learning has been around that, and actually it's encouraged me to seek that information now.
So Leanne, I'm going to ask you to cast your mind back to when you first qualified as a nurse. When you look back, what advice would you give yourself about how nursing would change?
So the advice I'd give myself, and it goes back a long way, so since 1987 I qualified, so it's quite some time ago. I would say that actually it hasn't changed an awful lot. Actually, the premise of nursing is still around delivering best high quality patient care that you can, that your heart and your soul is with your patient. But actually the digital platforms and agendas are there to help you do that, not to detract from doing that. So I don't think nursing practice has changed drastically. I think there are now more, there's more equipment available. Well, definitely, we didn't have fancy mattresses, air mattresses, that type of equipment when I was training or when I first qualified. And actually I said to you the other week, I remember using the first computer, which was a massive machine that really all it was say how many patients you had in the beds at the end of the day, but it must have cost thousands and was of really very little use. I don't think anybody ever really used the data, so that kind of stopped for probably about 10 or 15 years. But I think medical advances and equipment have shown that they're great from an interventional perspective about helping patients recover, but nursing has not really changed. The heart is still in it.
So to continue on that line of questioning, so if nursing hasn't changed in the last 30 years or something, do you see it changing significantly in the next 30?
Oh, we might be doing it from the moon maybe, or Mars, but no, I actually, no, they've been really interesting questions that our dialogues that we've had, and I can't see it changing very much because people are always going to need people. You're going to, I can't imagine a robot doing a bed bath, for example. They would never have that. Well, I would assume they wouldn't have that fine dexterity, but nonetheless, it's actually, as I keep going back to, it's the therapeutic relationship. It's the conversation with patients and their families that helps with healing as much as the medication that we might use or the next piece of equipment. So I can't see it changing particularly. I think maybe we'll have different roles, different ways of working, but fundamentally patients are still going to need people.